This drug belongs to the family of Ranunculaceae. Practically, this remedy is very effective in managing the sinusitis or post-nasal dripping. The person is constantly having a nasal discharge, which is very stringy, and this is not our Calibichromicum, or this is not our crocus, or this is not our lysine, or this is not our Myrica cerifera. It is a very effective remedy for the chronic liver conditions. As a result of chronic alcoholism, the liver is damaged, or liver is having a tendency for malignancy. This is not our Naxomica, or this is not our Ranunculaceae, or this is not our sulfuric acid. This is a very effective remedy for sore throat, very effective remedy for sore mouth, full of blisters in the tongue. This is not our nitric acid, or this is not our borax. Large flabby tongue shows imprint of the teeth. This is not our podophyllum, or this is not our mercurius. This is also a very effective remedy for many of the female complaints. It is indicated for CA breast, where before the ulceration sets in and severe pain. This is not our Carbo animalis, or this is not our Asteria rubens, or this is not our conium. Again, this is an excellent remedy for leukorrhea, where the characteristic of the discharge is stringy and which hangs down from the orifice. This is in short a remedy we call as golden seal or yellow root. This remedy is called as Hydrastis canadensis. Hydrastis canadensis, commonly known it as golden seal or orange root or yellow pucon. This drug belongs to the family of Ranunculaceae. Now, why this drug has been called as a Hydrastis? The meaning of Hydrastis, the name is given to this herb by Linnaeus. Exactly why he called it as Hydrastis, which is unclear. The first part of the word is said to be originated from the word hydro, that means water. As we all know, hydro means water. Rio, it means to flow or to pour, which may be because this plant has the diuretic properties. It is called as golden seal because the root has got a golden yellow color. It's also called as a orange root. It's golden yellow and orange in color. Or yellow pucon. Pucon means a root. We have several drugs belongs to the family of Ranunculaceae. As we all know, commonest drugs like aconite, Actia racemosa, Adonis, Clematis, Helleborus, Peonia, Pulsatilla, Ranunculus bulbosa, Staphysagraria. This plant is a native of United States of America and Canada. Since it is a native of Canada and hence it receives the name Canadensis, Hydrastis canadensis. To prepare the medicine, the root is been used, the fresh root is been chopped and prepared as per the pharmacopoeia. This drug has been proved by Dr. E.M. Hale. We have several other drugs with the name of root. For example, Spigelia has been called as a pink root. Rauwolfia serpentina, it has been called as a snake root. Phytoleca, it has been called as a poke root. So like that. So this is a drug commonly known as orange root or golden seal or yellow pucon or yellow root. This is in short about the introduction about Hydrastis canadensis. In this image, you can see a plant of Hydrastis canadensis. A green colored leaves, which is a leaf has got more of lobulated leaves. The leaf has got hairy portions. The stem also you can see fine hairs. This plant grows up to 1 feet in length. Mostly it gives flower from the month of May to June, and the seeds are ripened from the month of July to August. This plant is a species of hermaphrodite. The stem is purplish and hairy above the ground, and the stem is yellow below the ground, where it connects to the yellow rhizome. Because of that yellow rhizome, it receives the name golden seal or yellow root. Like many species of the buttercup or Ranunculaceae family, the flower has no petals. Instead, the many stamens surrounding the pistil produces the white color characteristics of this flower. You can see the flower doesn't have a petal. There are several alkaloids present in this plant. Hydrastis, berberin, berberistin, hydrastinine, tetrahydroberberistin, canadin, and canaladin. The alkaloid berberin, which has got an antifungal and antibacterial property, and hence it has got a natural antibiotic properties. Golden seal or Hydrastis canadensis is a small plant. As we all know, this is a native of North America. As you can see in this image, you have a leaf with a red colored fruit, which resembles that of raspberry. The fruit is very small. The fruit ripens in mid to late summer. The fruits are considered to be inedible, although they may be an important wildlife food. Hydrastis canadensis, which grows in shady woods full of rich soil and damp meadows. As you can see, the fruits looks like that of raspberry, and hence this plant is sometimes called as a ground raspberry. In this image, you can see a yellow root, a modified rhizome. Because of that yellow color, it has been commonly known as yellow root or orange root or golden seal. The yellow color is very intense. Because of this intense yellow color in the root, it has been used in olden times as a coloring agent. It has been used in olden time as a dyeing industry. The thick yellow rhizome, the stem of a plant with nodes, which is the most important part of this plant. From that, the mother tincture has been prepared and higher potencies are prepared from this root. Here we have a summary of Hydrastis canadensis plant. This plant has a lobulated leaf, which is hairy in appearance, which has got a raspberry type of fruits, which has got a white colored flower without petal, and it has got a knotted root which is dark or bright yellow in color. This root is the most important part of this plant. In olden time, the root extract has been used to treat the diseases of the eyes, to treat the infections of the skin. These are the few of the uses of Hydrastis canadensis. Hydrastis canadensis has got marked action on the mucous membranes. It has got action on the nasal cavities. It has got action on the bile ducts. It has got special action on the liver, stomach, intestine, uterus, vagina, skin, glands and muscles. By action of this drug on the mucous membrane, it will relax the mucous membrane and produces a thick yellowish ropey discharge. The catara may be anywhere, maybe in the throat, maybe on the stomach, or maybe in uterus, urethra. It is always characterized by this peculiar mucus discharge. In general, Hydrastis canadensis has got an anti-catarrhal property. It has got an anti-inflammatory property. It is an antiseptic medicine. It has been used as an astringent, and it is also has been used as a laxative. These are the short sphere of action and pathophysiological action of Hydrastis canadensis. Hydrastis canadensis is a slow and deep acting remedy. This drug is specially adapted to the old-aged individuals. We have several drugs for the old age group. There are remedies like bariatamur, lycopodium, opium, coca, specially adapted to the individuals who are easily tired, like our carboanimalis, like our cocculus. Also adapt to the individuals who are cachectic individuals, like our iodum, like our natramur, like our tubovenum. Individuals with marked debility, individuals who have a malignant dyscrasia, who are prone to get malignancies, like our carboanimalis, like our conium maculatum, with marked derangement of gastric and hepatic functions, like our arsenic alb, like our carbovegetabilis. The skin is generally pale and the patient is susceptible to get jaundiced, like our chilidonium, like our cardus marinus. So this is in short a drug mainly adapted to the individuals who are old, who are easily tired, who are cachectic individuals, who have prone to get malignancies, who always have a gastric and hepatic dysfunctions, and more often they have a jaundice. It's also suited to the people who have a feeble constitution. It is also adapted to the people who are chronically alcoholics, like our sulfuric acid, like our naxomica, like our agaricus, like our sulfur, like our syphilinum, like our tubovenum, who have broken down their system with excessive use of alcohol. This is in short about adaptability of Hydrastis canadensis. We'll see some of the keynote indication and some of the clinical indication of Hydrastis canadensis. This drug is not a rare drug we must have in our clinic. Several clinical conditions may require Hydrastis canadensis. Most commonest clinical conditions like sinusitis or liver disorders, or people who are prone to get malignancies, or the person who is suffering from constipation, or the person who's the females who are having leukorrhea. There are several clinical conditions we may think of Hydrastis canadensis, and let's see some of the key indication. The first keynote indication of Hydrastis is very peculiar about the discharge. The discharge is always a stringy discharge. The moment a stringy discharge means our mind always goes for calibichromicum. But calibichromicum is not only the remedy for stringy discharge. There are several other drugs that discharge are stringy, like crocus sativa, lysine. Very often lysine is forgotten remedy, or lysine is very rarely prescribed for stringy discharges. Myrica cerifera is an excellent remedy for it, has got an antiseptic property. Again, Myrica cerifera is a remedy for hepatitis or jaundice with stringy discharge. There is a profuse discharge from every orifices or from every mucosal outlet, which is thick, yellow, stringy, ropey mucus from the nasal passages. The stringy discharges are hangs from the orifices. That is the peculiarity of Hydrastis. The discharge is stringy. Now, how to differentiate calibichromicum and Hydrastis? Calibichromicum has got several other symptoms of Kali group. we have a swelling, early morning aggravation. The time modality is very peculiar in chalybochromicum. The spotty pain, aggravation, bending. There are several other modalities which will able to differentiate chalybochromicum from Hydrastis. A second indication of Hydrastis is about the tongue. The tongue is a large flabby tongue which shows imprint of teeth. The moment we hear about the large flabby tongue means our mind will go to mercurius, or we might have read podophyllum. But Hydrastis is also a very important liver remedy where the tongue is large flabby and which shows imprint of the teeth. We have several other drugs for these symptoms other than podophyllum, other than mercurius. We have arsenical, we have carbovage, we have got chelidonium, we have got sepia, we have got syphilinum, we have got some extent rustox. Now each drug has got its own constitution features to differentiate whether it's a mercurius. Mercurius has got a profuse salivation which is highly offensive, which is lacking in Hydrastis canadensis. You don't have much salivation. Here more the discharges are stringy, whereas in mercurius the discharges are profuse. Whereas podophyllum, it is mostly associated with other GIT complaints. Maybe podophyllum has got a diarrhea. Maybe podophyllum has got profuseness of the discharges. Rustox, again with vesicular lesions, with flabby tongue, with imprint, where the anterior part of the tongue is red triangular tip. That's how we can differentiate rustox. Hydrastis canadensis is also used in the treatment of constipation. We have several drugs for constipation. Which drug to decide? Whether to give Naxomica, whether to prescribe opium, whether to prescribe Silesia, whether to prescribe Bryonia. Each drug has got its own features to differentiate. Here the constipation where the stool is like a sheep dung stool. For the sheep dung stool we have several drugs, again chelidonium, opium, magnesium mure, sanicula. Here the stool is greyish in color, which is very hard and knotty, or some extent the stool is light colored. Here constipation with fissure in the anus, or constipation with the prolapse of the rectum, or constipation associated with headache. Here the pathology is different. Here the constipation is as a result of chronic liver derangement. It is not an acute phenomena like you get in chelidonium or like you get in bryonia. Here the pathology is more deeper than chelidonium, more deeper than bryonia. In chelidonium maybe simple viral hepatitis or bacterial hepatitis, then the person is getting constipated. Bryonia maybe because of dryness, maybe associated with fever, the person is getting constipation. Here as a result of chronic liver derangements, maybe a person is suffering from gallstone, or person is suffering pre-malignant condition, or the person is having cancerous condition associated with constipation, then we can think of Hydrastis. Associated, you must think that along with constipation there is a stringy discharges, which makes to differentiate between chelidonium, opium, bryonia, magnesium mure, sanicula. In sanicula, the constipation where the stool is crumbles has to be removed mechanically like magnesium mure. Another indication of Hydrastis regarding the malignancy. It is indicated for malignant tumors, hard adherent tumors, especially about the breast cancer, where the skin is mottled with severe sharp cutting breast pain, with the nipple is retracted. It is said that it is not in the last stages of cancerous conditions or cancerous state before the ulceration, where the pain is the principal symptom. Not in the advanced malignancies, in the initial part of the malignancies, or before person is going to the malignancies, or before the ulceration, there is a severe pain. Cancer may be of CA stomach, or CA liver, or CA cervix, or CA thyroid, or CA breast. Anywhere may be the malignancies where before the ulceration there is a severe pain. Even in the advanced cases of malignancy, you can prescribe Hydrastis provided you have some other symptoms like stringy discharges. Person is weak and prostrated, with large flabby tongue. All those associated symptoms are there. Definitely you can prescribe Hydrastis. Another peculiar symptoms of Hydrastis canadensis is regarding the stomach complaints. There's a empty all-gone sensation in the stomach. Our stomach feels empty. Even after eating, the stomach feels empty and not better by eating. Like our in Ignatia, like our sepia, empty all-gone sensation. We have sulfur. Sulfur also has got a peculiar empty all-gone sensation, especially about 11 a.m. We have empty all-gone sensation even in arsenic alb. We have got empty all-gone sensation even in sepia. Just like sepia, just like Ignatia, empty, faint feeling in the stomach, which is not better by eating. We have other drugs, empty all-gone sensation is better by eating. Like our iodum, like our anacardium, they generally feel better by eating. Even some extent lycopodium, temporarily better by eating. But here, not at all better even after eating. With loathing of food, associated with obstinate constipation, there is no desire for stool. Combination of all those symptoms will make to differentiate between Hydrastis, between sepia, between Ignatia, between anacardium, between iodum. Here, empty, faint feeling in the stomach, which is not ameliorated by eating, associated with constipation, associated with large flabby tongue, with malignancy tendencies, where you can differentiate Hydrastis and other remedies. Practically, Hydrastis is an excellent and more superior remedy in the management of sinusitis, especially for chronic sinusitis, where there is a postnasal dripping associated with inflammation of the mucous passages of the respiratory tract, associated with cough, with loose expectoration, with swollen turbinates, with a thick viscid nasal discharge. All the common symptoms of sinusitis will be there, but here more of chronic sinusitis with a stringy discharges, where the discharges hangs down from the orifices, associated with malignancy tendencies, associated with weakness, associated with prostration, associated with constipation. We can differentiate this drug from other remedies. Now, how to differentiate Calibicromicum in sinusitis? In Calibicromicum, you have got a spotty pain, the pain at the root of the nose with early morning aggravation, with postnasal dripping. All those common symptoms will be there. And Calibicromicum will have a spotty pain and associated with gastric disturbance also you see in Calibicromicum. Hydrastis is also very important remedy for the female complaints other than CA breast. It is also important remedy for erosion and excoriation of cervix. There is severe itching of the vulvae with profuse leukorrhea. We have several drugs for leukorrhea: creosotum, sepia, calcarea carb, ovatosta. Here it is mainly because of erosion and excoriation of the cervix with a tendency for malignancies, where you can think of Hydrastis. In creosotum, you have got more of offensive discharges, more of acridity, more of putridity. You can think of creosotum. Sepia is again a constitutional remedy, where the constitutional features of sepia definitely will be there. The person is more of indifferent lady, associated with butterfly lesions on the face, associated with severe itching of the genitalia, and they are totally indifferent personalities. We are more deeper in action than Hydrastis. It is also indicated for backache. There is a dull, heavy, dragging pain with stiffness of the back, particularly across the lumbar region, where the person must use his arm to get up from the chair. Otherwise, it's very difficult for him to get up. Backache, where the person has to raise with the help of arms, then only he can get up. For the backache, again, several drugs as common remedies like Rustox, like Ruta, like Arnica, Cobaltum. So there are Calicab. magnesium phos. Each drug has got its own features to differentiate whether to prescribe Calicab, which is based on the constitutional features, whether to prescribe Rustox, which has got its peculiar modalities, aggravation first movement and better by continuous movement, whether to Ruta, very sensitive back and very difficult to sit. Here it is mainly because maybe as a result of chronic constipation, maybe as a result of chronic liver derangement associated with backache, where you can think Hydrastis could be the remedy. Hydrastis is also a remedy for leukorrhea, which is ropey, thick, viscid yellow leukorrhea which hangs down from the os in a long strings with severe itching, which is again a big topic to differentiate about the leukorrhea. There are many drugs which I have described already in about pruritus, about Hydrastis, but still you can think of other remedies like Pulsatilla, where the Pulsatilla, all the discharges are bland except leukorrhea. The leukorrhea is very acrid. Creosotum is again a remedy for especially for the young females who grow rapidly, who grow so tall, associated with acrid corrosive leukorrhea with severe burning pain, severe itching of the genitalia, where you can think of creosotum, a tar group of remedies. Sepia is again a females who are very thin, females who looks like male, females who are indifference, females who are again discharges are highly offensive urine associated with leukorrhea, you can think of sepia. Kaliumuraticum is again a remedy for leukorrhea where the discharges are like white of an egg. Alumina is again a remedy for leukorrhea associated with constipation, associated with dryness, where you can think of alumina. Again, graphitis is again a remedy for leukorrhea, where there is especially during the menopausal time, a lady end up in getting leukorrhea. Leukorrhea gushes day and night. So like that, there are several drugs, but coming back to the Hydrastis, here the leukorrhea is very characteristically the leukorrhea which is hanging down from the hose like a long strings, which is a very ropey, thick, viscid yellow leukorrhea which hanging down from the genitalia. Another indication of Hydrastis regarding the alcoholics. Alcoholics with broken down constitution who are so much tired and broken down as a result of excessive use of alcohol and end up in getting jaundice or end up in getting chronic liver disease, maybe going for malignancies. Alcoholics leading to cirrhosis, leading to pre-malignant condition, and finally malignancies, where you can think of Hydrastis. Hydrastis is an excellent liver remedy. For the alcoholics, we have got other remedies like Naxomica, sulfuric acid, Pulsatilla, Carbovage who are broken down after alcoholics, or muriatic acid who are so weak after alcoholics. So there are some other drugs. Hydrastis is also indicated for the individuals who have alternate constipation and diarrhea. They will have sometimes diarrhea and sometimes constipation, both are alternating. We have several other drugs for these symptoms like Antimonium crudum, Chelidonium, nitric acid, Naxomica, opium, and Podophyllum. Each drug we can differentiate based on the other associated symptom. Next indication of Hydrastis from the beginning I am telling is this is an excellent liver remedy. This must be useful in a chronic deranged liver conditions where the liver is enlarged, where the liver is hard, where the liver is nodular, with a tendency for gallstone formations, with a pre-malignant state and tendency for malignancies, or secondaries in the liver, or final metastasis to the liver. There are several drugs for liver cancer, but I have used in several patients where the liver metastasis happened as a supportive treatment where they had a very good appetite after prescribing medicine. Their jaundice level is reduced after prescribing this remedy. So you can think Hydrastis is a liver remedy, especially for malignant conditions. Hydrastis is also a remedy for goiter, especially during the time of puberty and pregnancy. Goiter, which appears especially during the time of puberty and also during the time of pregnancy as a result of hormonal changes. The females when they have approaching puberty getting goiter, or female when she is pregnant, that time getting goiter. In general, we have several drugs for goiter. Commonly used remedies like iodine, thyroidinum, natromure, phytoleca, conium, calcarea iode, silesia. We have several other features to differentiate whether it's a silesia goiter, whether it's a iodine goiter, whether it's a thyroidinum goiter, whether it's a phytoleca goiter, whether it's a conium goiter. In conium, the goiter where the gland is very hard, stony hard. In phytoleca, the thyroid gland is firm in consistency, especially females who are very fat. Conium is more of the person who is so much weak and tired individuals with a goiter. Silesia is again individuals who are full of general glandular pathology. The person who is very much anxious, the person who is again constipated, where the person will have a goiter, which is hard with profuse sweating, which will help us to differentiate between natrum and silesia. Natrum is again a goiter as a result of emotional disturbance, as a result of maybe a grief, as a result of depression, as so much change in dynamics in his life, and finally getting goiter, where you can think of natrum. Iodine is a remedy, especially you can think of dark constitutions where there is a thyroid gland is enlarged, with the person is very hot, where there is a severe palpitation with high pulse rate, where you can think of iodine. Hydrastis is also a very important remedy for the sore mouth or aphthous ulcers, especially in nursing women with a large flabby tongue. We have several drugs for sore mouth, or we have several drugs for aphthous. Most commonly used remedies like borax. Borax has got a ulcer which is white in color with red appearance. We have nitric acid, aphthous ulcer with severe cutting type of pain. We have got rustox, is again aphthous ulcer along with vesicular eruptions around the mouth. We have sulfur along with aphthous ulcer, there's a burning. But hydrastis has a peculiar tongue where the severe pain with the stringy discharge, which makes us to differentiate between hydrastis and other drugs. Hydrastis mother tincture can be also been used mixed with water to gargle the mouth. Definitely within 1 or 2 days your aphthous ulcer will disappear. That much sure I can tell you. Hydrastis mother tincture can be mixed with some lukewarm water, and you can ask the patient to gargle the mouth. Within 1 or 2 days this aphthous ulcer will disappear. That is a peculiarity of hydrastis. It's also a very important remedy for smallpox. Smallpox is almost eradicated, but in the olden time, hydrastis is prescribed as a medicine for smallpox, both internally and locally. The power of hydrastis over smallpox seems to be modifying the disease, abolishing the distressing symptom, shortens its course, and lessens its dangers and complication. Now we may not get any cases of smallpox, but we must remember that this remedy has been used in the treatment of smallpox. Regarding the clinical indication of Hydrastis canadensis, clinically we must think that whenever we have an alcoholic patient with a chronic liver derangement, our choice of remedy can be Hydrastis. One of the remedy can be Hydrastis canadensis. For clinically, you can think of in alcoholics or any cancerous patient where there is a metastasis to the liver, where the liver is being deranged, or anywhere primary foci and finally metastasis to the liver or liver malignancies, you can still think Hydrastis as in a supportive medicine. We must think in clinically for sinusitis or post-nasal dripping with stringy discharge. We can always think Hydrastis could be one of the remedy, and we must differentiate from other remedies like Calibacromicum. Clinically, it is an excellent remedy for constipation. We must think also in clinical condition like cons or chronic dyspepsias or hemorrhoids or clinical condition like hepatitis with jaundice. In females who are suffering from chronic leukorrhea with stringy discharge, or the person who is suffering from chronic backache where the person has to use his arms to get up from the chair, for the lumbago where the person requires arm support to get up. It's an excellent remedy for sore throat. It's an excellent remedy for general ulcers, maybe of ulcer, maybe where the ulcers with stringy discharges. It is all. You must also think in a disease of the uterine complaints. This is in short clinical indication of Hydrastis canadensis.